Hello and welcome to our first ever topic, prevention and management of medical emergencies from Tucker Oral Surgery. So basically the main reason of recording these videos is to, encourage students to read their book before their final exam. So this could help you guys if you are not into, reading books, but it could help you really well. So as we know, the introduction is quite simple here that even though dentist emergencies don't happen very often, but they can be serious, especially during oral surgery. That's why the dentist must be trained to prevent emergencies, recognize warning signs, and handle problems early. So for this, we have to understand how to prevent them and how to manage these medical emergencies. So first of all, we have to understand why emergencies happen more in oral surgery. There are three reasons. First is more stress. Second is more medicines used, like sedatives, local anesthesia. And the third thing is longer appointment, which can, tire the patient. Other risk factors could include, the age could be young or old patient who are medically unhealthy or dentists using many types of drugs in office. So here, as we have to start, first we have to understand these medical emergencies written here these. So from most to less common, I will go. First is hyperventilation, seizures, also known as fits, or suspected hypoglycemia. These things like low blood sugar and vasovagal syncope written here is the most important one for your exams and also the most common find in the dental emergency room. And then visual syncope is like fainting. Angina pectoris, also known as chest pain, orthostatic hypotension, low BP after standing up, and allergic reactions, hypersensitivity. So these are usually triggered before, during, or after the treatment. So there is nothing to read in here. It is not, they're just giving an overview that how types of emergencies most common seen in dental office. So next is prevention. Prevention, we all know what we have to just understand from here is prevention is the best strategy. So step by step prevention, there are steps. The first step is risk assessment. So we have to take a complete medical history of the patient, ask specific health questions. Then we have to take and record vital signs like BP, pulse, etc., and then do a basic physical check if needed. These come in risk assessment. Number two, we have to recognize high risk patients. Patients with medical problems are more likely to get into emergencies when physically or emotionally stressed. Okay, so stress and trigger issues like fainting, asthma, angina. So we have to recognize the high risk patient. Then we have to modify our treatment plans. So for that, we have to be gentle, calm, calm, and fast with anxious or sick patients, and use less stressful methods or break procedures into shorter appointments. Consider refer to specialists if needed. So these are the things are listed here that we uh, have to plan the patient by while taking the prevention strategy. So the next thing is just we have to I have just given an overview of prevention of the medical emergencies and the prevention and all these things. Next we are coming on the medical emergencies commonly provoked by anxiety. So when the patient comes, the most important thing that is happens is anxiety. So after anxiety, you have to learn this box. It is very important for you, like angina, thyroid, MI, insulin shock, asthmatic, bronchospasm, hyperventilation, adrenal insufficiency, epilepsy, and severe hypertension. So they can be triggered by anxiety. So the next thing we have to, it is like anxiety, stress, and fear in patient can trigger it. So it is very important. Okay, so the next is preparation. After prevention, preparation is the key. Four steps to be prepared. The first step is dentist is updated through regular courses. He should know he should know the update version of everything. Okay, so that is very important. That is, something modernization. Then the staff is trained and does emergency drills. Okay, and third one is make emergency contacts ready. Like you have some contact with the doctor, ambulance, nearby. These things you have to take care of. And then office has proper supplies and space for handling emergencies. Okay, so the next thing is continuing education. So I will just give a brief overview of this, that the dentist must refresh emergency knowledge often. Okay, he have to attend some seminar or something like this, do basic life support training, BLS, use AED, automatic external defibrillator. He has to know that how to use it. If giving IV sedation also do ACLS, advanced cardiac life support. So the next thing is office staff training. I'm gonna get it more. You know, what about it is like train staff to recognize and respond during emergency, do mock drills every few months, assigning each staff member a role, like just tell him you have to call the ambulance, the second one helping in CPR, and the third one must do getting drugs. So the next thing is basic life support. We all knows it comprises of three things: ABC, airway, breathing, circulation. So you have to do this table also. It is very important for you. So the next thing is assist to emergency help. So what we see in here is access to help. I will make it more shorter for you. So we have to pre-arrange emergency contacts, like we have to have a contact with the oral surgeon, medical doctors, nearby dentist, ambulance, hospital, or emergency clinic nearby. And we have to keep the emergency phone numbers on each phone in the phone memory in your mobile contact. So it is very something very basic. Every dentist should learn and know. So it is important for your clinical training, not much more for your theoretical part of the paper, because it is something we have to take care of. Okay, so the next thing coming in here is like, what is next is that we have to take care office setup and equipment. What make sure our office has the following things. First is a good dental chair that let the patient lay down or head down, in a space for CPR, basic emergency drugs and tools like oxygen, sugar for hypoglycemia, epinephrine. We should have rescue tools, mouth to mask ventilation, bag valve, mask given here, mask to mask ventilation, and suction, BP monitor, stethoscope, these things should be there, and that's how it's gonna work. The next thing I just told you about these things, the dental chair should be that flexible that it can let the patient lay down flat. So the next thing is, this is a very important box for you guys. Emergency equipment in the dental office. So we have to understand few things about this thing is that airway and breathing support equipment. If something is suffering from airway congestion that he can't breathe, so we should have an oral and nasal airways. We should be keep airway open. Okay, last section, tips and tubing to clear the mouth and throat. Rustication, for rustication we need the ambu bags. Ambu bag is something to help the patient breathe. Clear face mask used with oxygen supply, laryngoscope and endotracheal tube. These things should be present for a person having difficulty in breathing. So the next thing is drug administration. Administration equipments written here. We should know syringes 5 to 10 mLs. Their capacity should be in needles, 18 gauge or 21 gauge for injecting emergency drugs. Uh, Tourniquet used to find and assess the vein. IV supplies, including IV tubing, all these things. This is a very important topic for you guys. Just learn it from here and just apply there. Oxygen supply is something that is a must. A must. It is very important. Every dental office must have oxygen in a portable tank. Dentists should know how to give oxygen under positive pressure using demand valve oxygen mask or nasal catheter or face mask. Keep oxygen available outside the operatory room, like in the waiting area. So, emergency drug kit is what you know uh dental clinic emergency dental clinic should have in there. Oh, okay. So we have done it. We have done hyper. Now we are going for emergency drugs. So emergency drug care, it is something very important in my, final uh, prof. I have this question on my exam. So emergency drug kit always have a label emergency drug kit in the office. It includes drugs based on common emergencies like epinephrine, antihistamines, nitroglycerin, glucose, aspirin, bronchodilators, injectable corticosteroids. Label each drug with their name, use, check expiry dates regularly. Okay, so the next continuing, we are going for hypersensitivity reactions. So, what are hypersensitivity reactions? This is basically, allergies. Allergic reaction can happen due to several reasons. It could be antibiotic, local anesthesia, latex, other drugs used during surgery. So, type 1 allergy, most dangerous, also called immediate hypersensitivity caused by IgE antibodies happens quickly after re-exposure to an allergen. So what could it cause is mainly skin rash, swelling, difficulty breathing, drop in BP, and anaphylactic shock. So emergency action that we could take is give epinephrine immediately, provide oxygen, call for emergency help right away. So that is all about from hypersensitivity reaction. You just give a read and what points I have told you guys, just insert it with it, and that could be something enough for you. So we did the drugs, and also one thing I have just missed in the emergency drugs is that.